The first test we're going to be doing for your hip, it's called the supine hip flexion test. This test is going to be taking a look at how well your hip can flex. So how close can your leg bone get to your rib cage, and if it can touch your rib cage, that's full. If it cannot, we're going to call that limited. And if it cannot, we're going to ask you where the tightness is, where the pain is. If your leg can touch your rib cage, we're going to have you write down if there's any pain or pinching anywhere in the range of motion. The way that this test is going to work is we're going to have you lay face up. It's going to require a partner. Your partner is going to grab the leg closest to them, putting their hand behind your knee joint, and then they're going to apply pressure, pushing your leg towards your rib cage. We're going to do this in 3 different motions. We're going to do it straight ahead. We're going to do it a little bit to the outside. And we're going to do it a little bit more to the outside. So the very last position is going to be like a frog leg stretch. And then we're going to have you determine if it's full or limited in all 3 of those positions. And then we're also going to have you take a note as to if you feel any stretching, any pinching in your hip or in your leg or in your lower back. Hips are an extremely important part of the kinetic chain in regards to weightlifting and or crossfitting. Any hip pinching in the bottom of a squat, whether it's squat clean, squat snatch, front squat, or back squat, it's going to be dealing with some of the interior hip tissues as well as the hip capsule. This is a good test to try to distinguish what exactly the problem is. If you're having hip pain and this range of motion is full, well, then your problem is a strength balance. If you're having hip pain and this is restricted, well, then your range of motion is going to be part of the problem. I had a patient I was working with about 2 months ago who every time they got into a very deep front squat, they always felt a pinch. They were trying some different techniques to get rid of it. They were trying stretching. None of that really seemed to work all that much. We put them through this test pretty quickly. Found out that the right side was limited. This relates to posterior hip capsule tightness. We put them through some of our programs, some of our warm-ups, cleaned up the range of motion. Now they're squatting pain-free. Typically, it's a pretty easy fix if you find the right problem and the right range of motion issue. So once again, we're going to have you lay on your back. Your partner is going to put their hand behind your kneecap. We're going to push your knee towards your rib cage. We're going to do it in 3 different levels. Straight on, a little bit to the outside, a little bit more to the outside. I want you to know if it's full or limited, if there's any pain or pinching or stretching. Any questions?